very scary figures that eventually by 2050 we'd have more deaths per year from antibiotic resistance related deaths than from cancer. In countries like Australia, the United States, the vast majority of antibiotics that are used aren't used in human beings, they're used in animals. So even if you're a vegetarian, the vegetables that you get from farms that are grown on farms, they might be irrigated with water that's got contaminated by waste from these animals, which contain those bacteria. So I call that more as a silent pandemic. It's because of the vaccines that COVID didn't turn into something that could have been a heck of a lot worse. But we definitely saw that there was vaccine nationalism where people wanted vaccines for themselves.
Dr. Sanjaya is an infectious disease specialist who delivered over 1,000 interviews during COVID. What he's saying today is something you all need to hear.
The reason we have to worry about it is that the most likely source of the next pandemic will be an infection that comes from the animal world to the human world. But I keep telling people that just because there was 100 years between COVID and the Spanish flu pandemic doesn't mean there'll be 100 years between COVID and the next pandemic. The reality is that the next pandemic could be just around the corner. In this patient being assessed for what was thought to be a brain tumor, but when the surgeon went in there, she thought that there was something lumpy which didn't look like a brain tumor, but she wasn't sure what it was, and she was almost going to ignore it, but then decided with some forceps to just pick at it, and she was suddenly holding a worm in her forceps. And not just any worm, but a live, wriggling worm. So there's different levels of fame, and at the lower level, someone like me, who's a health expert who comes on in the media every now and then, versus, I use the example of Lady Gaga. And my experience of fame is quite different to her experience of fame, and hers is 24/7 in your face and probably very uncomfortable, which is why has bodyguards and things like that. Coming here today, walking from the car to this room, I didn't get mobbed by people wanting to take selfies or trying to take off my shirt or anything like that as a memento. But the reality is I'm a full-time doctor who sees patients and treats patients with complicated infections. And I work 7 days a week, basically. Go to hospital 7 days a week to see patients. And on top of that, medicine does take an emotional toll on you. And within the medical profession, there are high suicide rates.
Dr. Sanjay, thank you so much for making time to have this conversation. It feels like I'm speaking to a friend, speaking to somebody who is very familiar, because you spend so much of time giving us information through a pandemic, but also keeping us calm and informed. And for that, I'm deeply grateful. Thank you very much.
Thank you very much for that compliment, and thank you for having me today.
From a professional perspective of being an infectious disease professional, what are the things that we don't know about something that's emerging, but we need to be aware of?
Well, probably a couple of things come to mind. There's the silent pandemic, which has been there for we've been aware of for the last 10 years at a number of levels, but has always been there, which is antibiotic resistance. So antibiotics came around about, close to 100 years ago. And if you think about how long humanity has been around, let's say a few 100,000 years, for antibiotics to become resistant or bacteria to become resistant to antibiotics in such a small period of time, sort of under 100 years, is quite scary. And antibiotics have changed the face of medicine. People used to die left, right, and center of infections. But because of antibiotics, people recover from these life-threatening infections and lead their normal lives. But what we have definitely seen is, for various reasons, antibiotics becoming less and less effective, and also a reduced production of antibiotics, because really just related to the cost of producing them for drug companies. And as we do that, we're seeing more and more people dying from antibiotic resistance around the world. So that's sort of a silent pandemic, and we've tried to increase awareness. We've recently had Antimicrobial Resistance Awareness Week to try and internationally make people aware of this. In fact, David Cameron, the former British Prime Minister, he commissioned a report. He got Jim O'Neill to chair this. Now, Jim O'Neill is in the economic sphere. If you've heard the term BRIC, Brazil, Russia, India, China, he's the one who coined that term. So a very famous economist. And he put out a report, must be close to 10 years ago, about antibiotic resistance, with some very scary figures that eventually by 2050 we'd have more deaths per year from antibiotic resistance related deaths than from cancer, and the cost would be in the trillions. So that's one of the big things we have to worry about. So I call that more as a silent pandemic, but I guess in the more conventional pandemic that your listeners will think about, we've had COVID, and before that we had the Spanish flu 100 years earlier. But I keep telling people that just because there was 100 years between COVID and the Spanish flu pandemic doesn't mean there'll be 100 years between COVID and the next pandemic. The reality is that the next pandemic could be just around the corner. And we know what happened with the last pandemic, how disruptive it was to our lives, not just locally, but internationally. But that is something we have to worry about at the moment. The reason we have to worry about it is that the most likely source of the next pandemic will be an infection that comes from the animal world to the human world. And the technical term for that is a zoonosis, or a zoonotic infection. And in the last 50 years or so, you'd be surprised to hear that we've probably had 50 new infections appear in the world. And about 3/4 of those would be zoonotic infections from the animal world to the human world. And the reason that is happening is because the human population is burgeoning. I mean, we're seeing big population growth globally. And as we've got more people, they need somewhere to live. So we see human populations encroaching on previously untouched animal or wildlife habitats. And therefore you're getting human populations with their domestic animal populations, not just pets, but farm agricultural populations, so cows, sheep, goats, pigs, etc., chickens, etc. And they're interacting with wildlife. And that's allowing infections in the wildlife population to be transmitted to domesticated animals as well as humans. And the mutations can occur when that happens, and then the infection can become more efficient. So they're the things we have to worry about.
This is how much of a fanboy I am of your work and the clarity you provide. I know the term AMR. I have heard you say that 70% of antibiotics is used in animals. And that could also, be one of the reasons that we're getting this antimicrobial resistance. It's not just because a doctor is prescribing us antibiotics. If I delve a little deeper into it, growing up, if we had an infection, or if I have my young children who have infections, doctors prescribe antibiotics. A lot of the time, that helps them. But I also, as a parent, see in our social media echo chambers or our digital media online, that's killing your gut bacteria. How does a non-medical professional balance these two?
Well, first of all, I'm glad if you've actually listened and learned about antimicrobial resistance and you think about antibiotic usage generally, then I'm glad. That's reassuring to me. It means I'm doing my job properly. So thank you. Good. But so you've raised a couple of issues. So the first one is using antibiotics when perhaps they're not necessary. So one part of antibiotic resistance that's occurring globally, part of it is occurring because of the way we use antibiotics in humans. And the vast majority of colds and coughs that we see in children and adults, the vast majority are due to viruses. Now, sometimes after a viral infection, the inflammation can allow bacteria to cause an infection. But if it's purely a viral infection, antibiotics don't make a difference. So one part of our strategy in trying to address antimicrobial resistance is to educate doctors in primary care, so general practice, and doctors like myself who work in hospitals to use antibiotics or to think about how they use antibiotics and to only use them when appropriate. So that's one thing. But you've also raised another issue, which is you talked about antibiotics being used in animal populations. And that's good that you know that because, people don't realize that in countries like Australia, the United States, the vast majority of antibiotics that are used, the vast volume of antibiotics that are used aren't used in human beings. They're used in animals. So because with farming, you want healthy animals, whether it's cows, sheep, goats, poultry, etc. So therefore, animals get sick and you need to treat them. So antibiotics do get used a lot in those populations, and they account for the vast majority of antibiotic usage in places, in a lot of developed countries. And the reason that can be an issue is that those animals that are exposed to antibiotics, they have bacteria inside them. Those bacteria that are exposed to the antibiotics become resistant to the antibiotics. And then we come into contact with those animals, either by eating their meat, or if you're working on a farm, by touching, having physical contact with the animals. And even if you're a vegetarian, the vegetables that you get from farms that are grown on farms, they might be irrigated with water that's got contaminated by waste from these animals, which contain those bacteria. So an important part of addressing antimicrobial resistance worldwide is making sure that we speak to our agricultural colleagues, our veterinary colleagues, to make sure that animal usage of antibiotics is appropriate. So addressing antimicrobial resistance, it's a multi-pronged strategy. So it's not just asking doctors to prescribe antibiotics appropriately, but it's looking at various things like animal health and using antibiotics when appropriate, aquaculture, so even with fish, etc., and even waterways. Waterways can get contaminated with antibiotics as well as other chemicals, and bacteria in those waterways can become resistant to those antibiotics because they're exposed to them in the waterways. So there were some waterways in India that had such high levels of ciprofloxacin, which is an antibiotic, which probably came from hospitals or chemical factories, that they were therapeutic levels if they'd been in human blood. And of course, all the bacteria sitting in those waterways become resistant. So there's that. And probably the other thing you touched on with growing up in many parts of the world, the developing world, you can get access to antibiotics just over the counter. So parents in Sri Lanka or India, my child's got a cough, I'll get them some antibiotics. So you don't even have to bother about seeing the doctor. You can bypass them entirely to ask if the antibiotic's appropriate. Just go to the chemist, get some erythromycin or something like that, and take it.
Some parents get a little sad, hurt, upset, or a combination of that when we see a doctor in Australia and the doctor doesn't give you antibiotics. It's about, I want to make my child well faster. And that's the parent's intent. It is then up to the professional there to prescribe what's appropriate for the child. I'm just also very curious about antibiotics and its impact on the gut health.
Yes. So you mentioned that, which is that's also an important issue, and you're quite right. Even if you've got a cut in your little finger that's become infected, and you take some antibiotic tablets, yes, the antibiotic tablet will treat that infected finger, but it does go all over the body because it gets absorbed into the bloodstream, and it'll go all over the body, including the gut. So therefore, a byproduct is of that antibiotic use, it will kill your gut bacteria. Now, you may not actually realize that that's happened. Sometimes that can happen because there's a bacterium called Clostridioides difficile, or C. diff. Now, if you have that in your gut with all the other billions of bacteria that you have otherwise, and you take antibiotics, the antibiotics might kill the other bacteria, but not that one. And because it's now got less competition, it can multiply and produce toxins, and it can give you a serious form of diarrhea called C. diff infection or C. diff colitis, to the point where you sometimes need to be hospitalized, and you definitely need another antibiotic to treat that. So that's one of the more overt things that a patient knows about when they take antibiotics. But you're quite right, it is killing the bacteria in your gut. Now, within a month or so of stopping the antibiotics, the vast majority of bacteria will have returned to your gut and reconstituted normally. Some people try and speed up that process by taking probiotics, etc., but things will settle down. But generally, in the last, I would say, 10 years, we're thinking more and more about what we call the microbiome, the community of bacteria that lives out in our intestinal system. And we're only now just starting to understand how it may help, because there may be associations, even though it's bacteria living in the gut, with mental health, mood, various things. So there was a story on ABC about someone with a mental health condition called bipolar disorder, and the partner of this particular person gave them fecal transplants, basically. So changing the constitution of bacteria in that person's gut by being a donor. And that person's mental health condition improved. Now, I'm certainly not telling your listeners that this is a proven, officially recommended way of doing things. But all I'm saying is that now we're starting to think about the consequences of changing the bacteria in our guts and in our body with antibiotics. Look, generally overtly, we treating literally thousands of patients. I haven't seen any major issues over almost three decades when using antibiotics. But as we do the research, we are seeing how bacteria in our gut interact with the rest of the body in a way we never used to consider before. So it's really interesting research, and it might end up having some therapeutic benefits. And of course, the trials will have to follow.
I enjoyed your segment on the AMR and learning about it, specifically because I have an interest in tourism and I've done some work in that sector. And I see a lot of people going on safari, whether it's to Sri Lanka or different parts in Africa. I see lots of people taking their young children and going on farm tours. I also see stats that get thrown out around how many McDonald's burgers get consumed, and forget the rest of the health consequences. I'm thinking of that thick meat patty. For us, when we live our day-to-day lives, are there some practical things we can do to keep ourselves safe from not overly exposing ourselves to lots of antibiotics in the environment?
No, look, as a consumer, there really isn't too much you can do in terms of your dietary and beverage intake. I think the onus of that comes at the level of primary producers, vets, and farmers, as we talked about, in terms of making sure that antibiotics are used responsibly. We minimize the exposure of animals to antibiotics. So I think as a consumer, you can't be expected to do anything about that. I think as a consumer, the main area where you can make a difference is, as we talked about, when you see a doctor about an infection, being open to the advice that this is likely to be a virus and not require antibiotics. And similarly, if you're listening to this from a developing country where you, or any other country where you have access to over-the-counter antibiotics without needing a prescription, thinking twice before doing that.
Another thought that came to my mind while you were sharing this information on AMR is the role of the policymaker. There are lots of policymakers that govern how, waterways are managed, how farming land is managed. In your opinion, while you're doing, while the campaign told a lot of people about the impact of AMR and what's happening, do you think there is enough interest, awareness, and attention amongst the key policymakers?
Yes, I do. And you've raised the important point that we need policymakers to be involved. So some of the things we've talked about as being contributing factors to antimicrobial resistance, animal health, animal use of antibiotics. So we're looking at agriculture, waterways being contaminated with antibiotics. So that's an environmental issue. And of course, a health issue with how doctors prescribe antibiotics, having over-the-counter antibiotics, better vaccines to be produced so that people don't get infections in the first place, where they don't need antibiotics, better diagnostics being produced so that earlier on we can diagnose a specific type of bacterial infection, so we don't need to use such a broad antibiotic. For so long, we can use a narrower antibiotic, which is less likely to be an issue with resistance. So if you look at all, and very importantly, the development of new antibiotics, because as I mentioned before, there isn't a huge amount of incentive for drug companies to make antibiotics, because by the time they have done that, they're already at a loss. And then that pharmaceutical company takes this new wonderful antibiotic that they've made, and they come to a hospital and speak to people like me, infectious diseases physicians, and I'll say, this is a wonderful antibiotic that you've made for so much money. Yes, I'd like to use it all the time, but it's such a good antibiotic, I'm going to put it on the shelf and only use it when we really need it. So from the drug company's point of view, they put all this money into producing this antibiotic. They've come out at a loss, and now that they could make money with this antibiotic, they can't, because it's such a good antibiotic, we only want to use it in the most dire of emergencies. So basically, you need governments involved in regulation of pharmaceuticals to come to the party, to have incentives at both ends. So in terms of reducing the regulatory obstacles for drug companies to get antibiotics approved, and at the other end, in terms of paying them for antibiotics usage, perhaps even if they're not being used. So that way the drug company knows they're guaranteed some sort of income. So that involves a lot of policymakers at the highest levels of government. So all these risk factors I've talked about, we cannot control antibiotic resistance unless the highest echelons of government are involved. And I said at the start, it is happening. We've had, at the United Nations, we've had the highest levels of government sign that they are working together as a global community to try and address antibiotic resistance. So it is recognized as an issue. But yes, at my level, we have to make sure that the politicians continue to have that same level of enthusiasm and interest, and particularly at an official level like the UN.
And that's fantastic to hear that there is momentum gathering and there's work happening in that space. Thinking of a pandemic that we have experienced in dealing with, your co-chaired the ACT COVID-19 reference group. What have we learned from dealing with that pandemic?
What have we learned from COVID? Gosh, I think we've learned so much. So there's so many lessons. I think some of them are that we really need good communication. That is so important because people were terrified during COVID, and that's completely understandable. So you need clear messaging and you need honest messaging. So the COVID report that came out in the last year or so, which one of my colleagues, Professor Catherine Bennett, was involved in, provided recommendations about moving forward to the next pandemic. And one of them, was being honest, good communication. So it's really important from a governmental point of view. You want to give that reassurance to the public. So you may be tempted to say that everything is fine, we know everything's going on, but I think it is very important to tell people, look, this is a fast-changing field. We don't know all the facts at this point, but this is what we know. This is what we don't know. So that's really important. And that's really important so people will continue to have trust in you when you make tough decisions during the pandemic. And you also don't want, because if you don't get it right, you're going to get people who become anti-governmental and promote conspiracy theories. And we have seen a big problem with anti-vaccination messaging and strange conspiracy theories throughout the COVID pandemic. So I think that's a really important one. In terms of the pandemic, one of the most wonderful things about the pandemic was how quickly we got vaccines out. So it was early 2020, the pandemic started, and by the end of 2020, we had vaccines that were ready to be used. So that was such an extraordinary thing. I knew it would happen quickly, but I didn't think by the end of 2020 we'd have vaccines. And it's because of the vaccines that COVID didn't turn into something that could have been a heck of a lot worse. And that now today we live with COVID rather than die with COVID. So it's become something at the moment like influenza. So it's just become another one of those respiratory infections. And that's thanks to immunization. So I think one of the lessons are that we are capable of enormous ingenuity when we are really pressed against a wall because of this, something like a pandemic. So that was a wonderful thing to see. And I think what we learned about the Australian people was that they were wonderful to see how they listened to the health advice and how they took up vaccinations. I think that was a great lesson, that they were overall in Australia, we're a very sort of health literate and sensible society. And that was one of the reasons for success during COVID. The other thing I would say is that we need to think in Australia about how we deal with travel restrictions if we have another pandemic. So closing the borders made a huge difference when that happened early on in March 2020. That really restricted the amount of COVID, at least at the start of the pandemic, to Australia. But looking at how we deal with people who are coming into Australia and how we keep them in quarantine. The hotel quarantine in some parts of the country, particularly Victoria, was not up to scratch. So we need to make sure we have a more uniform plan for that. Also, now, even though the pandemic has ended, even though COVID's around, the pandemic has gone, we need to make sure we keep thinking about pandemics. Because I remember even before COVID started, we all would do, every health jurisdiction does influenza pandemic planning. So you all do exercises. I'd heard of one jurisdiction where they just stopped doing it because they just didn't think it was worthwhile. So we have to realize, as we talked about, the next pandemic is just around the corner, that we keep doing that. The other lesson we learned, I think, is that Australia needed or needs a Centre for Disease Control, what's called a CDC. You've heard the United States has one, and Australia from January next year has its official CDC. It's in an interim state at the moment. A Director General will hopefully have been hired by now. I don't think any announcements have been made as yet. And that will be up and running. And one important task for them will be to coordinate pandemic preparedness and pandemic responses with the states and territories. So I could keep talking about the various lessons that we've learned, but they're some of them. And vaccine inequity, that's the other thing. What happened during COVID is that the vaccines were produced very quickly, but we definitely saw that there was vaccine nationalism where people wanted vaccines for themselves. And there was a reluctance to distribute it globally. And there were a lot of, particularly in places like Africa, it could have been disastrous. But thankfully, for various reasons, COVID didn't take as big a hold as potentially it could have. And we have to make sure we somehow get around this issue of vaccine nationalism, where we ensure that there's vaccine equity. Because at the end of the day, with global travel, even if you protect Australia's borders or England's borders or Germany's borders, if you have a lot of an infection somewhere else, with the ease of global travel, it will get into your country. So it is in our interest, as well as being a nice thing to do, to look after our less developed nations and ensure vaccine equity.
Doctor, you and your colleagues kept us calm. We did what we needed to do to get over the pandemic. Yes, COVID's around, but now we're very comfortable. In that complacency, and because we touched on cycles getting shorter, with the good cycles of vaccine production, great win, yes, but pandemic cycles also may be getting shorter. What do we need to be less complacent about?
I think in the community, the general community, look, people need to lead their day-to-day lives. So I think as a lay person in the community, I don't want you to be stressed about pandemics. I want you to lead your day-to-day life. It's our job to make sure that we're keeping eyes out for any pandemic, so good surveillance. So I've talked about the Centre for Disease Control, and other nations have similar surveillance structures in place. So we need to keep an eye out for these new pandemics and try to minimize them by making sure that antibiotics are used appropriately, etc. I think for the consumer, once the pandemic occurs, that's when the layperson in the community has to bear some responsibility. And again, looking at COVID, simple things. If you're sick, get tested. If you have the infection, don't mix with other people. And if you have an infection but haven't been tested and it's a pandemic, don't mix with other people till you've ruled it out. So really simple things. And if you're instructed by health authorities to do certain things, take antivirals or take vaccines. And again, the onus is on us to make sure that we give you clear information with a sense of honesty that can engender a sense of trust. Then do those things. And that's what I said. Australia did such a wonderful job during the pandemic. So I'm very proud to be living here to see how well the people responded.
And the basis of my question there is, we did simple but effective things like hand hygiene. We had sanitizers around. I'm not saying people aren't washing their hands as much, but some of that messaging isn't there. Now, I understand we need to be living our lives and be comfortable and all of those things. some of those practices, doctor, that you mentioned are easy to do. They're not intrusive. If you're unwell and you haven't got tested, then get tested. If you are feeling unwell, make sure your social gatherings reduce. How does the general population be aware of these things in the medical profession? Is there awareness to have a little more campaigns that come in from time to time during Christmas? So, because I'm reflecting back on, let's say, ACT policing, saying, don't drink and drive. And that messaging intensifies during Christmas. I'm not saying people are drinking and driving at Christmas, but the messaging intensifies there. Is there some of those cycles that happen within the medical profession also to say, look, I'm going to do a little bit of a reminder now? Is that something that happens?
Look, it's a good point. I don't think we do that enough with the public. And the main issue, I suspect, for infections would be in winter, when there are a lot of winter viruses around, particularly influenza. And there's certainly drives to get influenza vaccinations. For the vast majority of the population are eligible for vaccination. Some people have to pay for it, other people it's free. But it's a simple intervention that can make a flu season much easier, depending on the strains of flu that are going around and how well the vaccine fits with that. So that's one thing. But the other things I talked about, they look common sense and courtesy. I mean, if you have an infection and you go to work, yes, it might not be COVID, it might not be influenza, but you're putting other people at risk of getting that infection, and they might not end up in hospital, might inconvenience their lives in other ways. It's just common courtesy, thinking about other people, not being selfish. You mentioned washing your hands. I mean, yeah, that's really important. But while I'm an advocate of using the alcoholic hand rub, it's definitely something we should do in healthcare facilities all the time and aged care facilities all the time. And and if you're in childcare centers, making sure you either use hand rub or wash your hands a lot with soap and water. But otherwise, don't wash your hands excessively. Yeah, just common sense things.
You touched on us also encroaching on animal habitats. Now, when I think of that practically, I'm thinking, I see you on TV a lot. I also saw you speaking about a lady that had a live worm in their brain. Yeah. And then you gave us some insight of what's happened, but you also reassured us the person was stable and it's not something for all of us to start worrying about immediately. Can you give me a little bit of insight of what that situation was? Also, if it's possible to share if the person is doing well, if you've learned something more about it.
Yeah, this was a remarkable case. So it's in infectious diseases to find a new infection in the world in a human being is one of those things you hear about but never necessarily think you'll be involved in. But I was involved with this case. It was a lovely patient, and this patient had some health difficulties for a little while before the diagnosis was made. And it essentially culminated in this patient being assessed for what was thought to be a brain tumor. But when the surgeon went in there, she thought that there was something lumpy, which didn't look like a brain tumor, but she wasn't sure what it was. And she was almost going to ignore it, but then decided with some forceps to just pick at it. And she was suddenly holding a worm in her forceps. And not just any worm, but a live wriggling worm. So my colleague, the neurosurgeon, she told me, whenever you operate on a brain, you never expect to find anything living. So it was a real shock to everyone in that operating theater. So that, as it was, that was a very unusual occurrence. And then when we examined that worm, we found out that it was a worm that had never been found to cause an infection in a human being before. It was well recognized as causing infections in Australian wildlife, but not in human beings before. And that's the other thing, a wonderful thing. We talked before the interview about Canberra being a wonderful place to live in. The other, apart from being a lovely place to live in, bring up a family, the nice thing about Canberra professionally is that it's a small place, but because it's the federal capital, you've got all these important scientific and other public institutions very close by. So and therefore you have networks that you can access very quickly. And in terms of physically getting something from one place to another, it's very quick, unlike the big city centers. So we were able to rapidly get the worm assessed and identified by a scientist in a local institution who gave us the diagnosis. And we eventually determined that what probably happened was that this person who lived down the coast would make salads with a particular type of native grass, which a lot of people do. It's not a grass that I'd heard of, but I subsequently learned that a lot of people do collect it and make salads from it because it's very tasty, very nice apparently. And what we think happened is that this particular parasite, it lives in snakes, particularly pythons. And we suspect what happened is that where this person collected the native grass from would have been visited by these pythons and who would have defecated there, and the droppings would have gotten onto this particular native grass. And when preparing the grass, even cooking it, if it wasn't, if you're preparing it as a salad or something like that, it potentially would have been ingested, and this person became an accidental host. So we think that's what happened. And we reassured people because this had never been seen before, and subsequently we haven't heard of it. So we didn't think this was likely to be a common event by any means, but we also wanted to educate people so that we knew that it was out there, and that if a similar case was seen by a doctor in Australia or perhaps even other parts of the world, they might recognize it earlier because we talked about this particular case. So it was interesting, it was educational, and we were very glad that for this particular person who had been unwell for a while because of this, we'd been able to provide a diagnosis. And compliments to the patience of this particular patient.
Fantastic news, that one. I've heard of worms in different parts of the body. There's worming treatment little children get when they play with sand and things like that. I've heard of ringworms. I've heard of uncontacted Amazonian tribes having ringworm and all of that. How does a worm get to the brain?
Yeah, and look, we're not 100% sure how this particular worm got to the brain, but there's a whole field within our field of infectious diseases. There's a whole field of parasitology, and there are various parasites and worms which enter the human body differently. Sometimes it's through the skin, other times it's by swallowing it. And they each have a different life cycle, and they can spread to different parts of the body. Some might end up in the liver, some might just stay in the gut, others might get into the muscle, but there are some that enter the brain. So the commonest cause of epilepsy or seizures worldwide is due to a parasite called neurocysticercosis. So that's the commonest cause. So you do get parasites in the brain. So it's not the first time a parasite's been seen in the brain, so that can happen. But it was the first time that this particular parasite had, not only infected a human, but even in the animal studies where we looked at it, we'd never found a report of it entering the brain. But yeah, there are various ways to get into the brain. You can get there. I'm not saying it happened in this particular case, but through blood vessels, directly entering through the spinal canal, perhaps, sometimes going through the sinuses in the nose. So there are various anatomical ways that it could have gotten in. But almost certainly when it entered, it wouldn't have been the 8-centimeter worm that it ended up being. It would have been a much smaller organism that grew once it got there.
Dr. Right throughout your responses now, but also listening to you during the pandemic at home, I've heard reassurance, confidence, and calm. Is that something you practice to do? Because you just mentioned that, if we ever face a pandemic, we've got to be honest, open, and truthful and connect to people. And you've done that so well. But there's also a sense of calm. There's also a sense of, I know what I'm speaking about, and I'm going to keep you calm. And if I don't know what it is, I'll tell you that, but I'll keep you calm. Where does that sense of being able to project calmness come from?
I think I'm generally a very laid-back individual. Like everyone, I can get stressed at various times, but my demeanor is generally very laid back. If you get to know me, I've got a crazy sense of humor. I'm always cracking jokes here and there. So that's just my personality, I think. Before the pandemic, I was in the media, and the things I talked about usually weren't at the same level as a pandemic in terms of seriousness. I mean, it's certainly with serious things, so plague outbreaks, but in different parts of the world where I was just providing commentary, and it may not have been directly affecting Australia, or might be a Legionella outbreak in a Queensland hospital, which of course is serious, but different to a pandemic where we didn't know much about the virus, didn't know what it was capable of, didn't know when we'd have a vaccine, didn't know when we'd have antivirals, which takes it to another level of stress, anxiety, and fear. And I don't know if I ever made a conscious effort, but at some point I did realize that it was very important not to make people panic, to look at the good side of what we were offering in terms of health knowledge, health advice, rather than focusing on the negative things. And as we talked about during the pandemic, things were evolving so quickly. So I, as an expert, and I use that in inverted commas because during the early parts of the pandemic, there were so many things that were unknown. Yeah, I had to be open to saying, look, I don't know. Next week I might, but this week I don't know. Or similarly, what I told you last week is wrong because we've now learned this week that the virus does this or this particular strain does that. So it was very important for me to make sure I was honest about it. And of course, because people were so stressed, I made a point to be calm. And I know not necessarily all my colleagues who were in the media were that way inclined. Some were a little bit more inflammatory on some occasions than others, but I didn't see any benefit in doing that. And I wasn't there to push an agenda. I was there to objectively, that was my job was, in my view, was to objectively report on what was happening. So that is how I viewed my role.
Because when I look at the media landscape, people get their message across in different ways. Without calling out people, some leaders of countries got their message out by, calling the virus a different country's name, or speaking of hydroxychloroquine or whatever those things are. You can scream and get attention, or you can speak gently and get attention. Was it that you, through your media training, said, look, what's the best way to get this message across? But I also was conscious of not only the physical health, but also the mental health challenges, uncertainty, lockdown, all of that was causing. Even in retrospect, when I think about it, I'm like, yes, it's a really stressful time in so many aspects. And anyone who's kept us calm, we're so grateful for. Was that part of your thinking in terms of how you delivered some messaging?
I don't know how consciously I was thinking about that. As I said, at some point, I may have briefly thought about just I need to be calm with certain issues that came up. I can't be inflammatory. And the other thing, which was very important with COVID, is COVID, as you've talked about in the introduction to this question, it became very political. The media work I've been doing for 15 years plus, when I talked about stories like plague in China or a Legionella outbreak in Queensland or something like that, it generally wasn't particularly political, but this became very polarized politically and in large numbers. So there were people who were listening to every word that you were saying and potentially trying to create a political diatribe about it. And I became conscious, particularly during the Melbourne lockdown, of not being one of those people. So I just made a point to report things as they were happening. And if I was asked to give my opinion on certain things, I'd give it to the best of my ability. But I certainly tried not to be inflammatory, because the poor person at home who's suffering, who's afraid, it didn't help them in any way.
For someone who'd be keen to follow your footsteps and be a physician, but also be a really powerful communicator, people sometimes get distracted by algorithms and reach. And, if I say something slightly sensational, then my reach is much further. In your experience, if somebody wants to now get into communicating and someone's a fantastic physician with experience, what do they need to be mindful of when they first get into media?
And I think, without naming names, I've seen professionals, not just health professionals, where I've watched them and inflammatory comments have been made, and you sort of think, you're doing that to increase your profile, aren't you? So you do see that. Yeah, which is not something I'm interested in. I'll give you a background to how I got into the media. So you mentioned media training. I've never had media training. So when I came to Canberra, my boss, Professor Peter Collignon, he's just retired as a really wonderful infectious diseases physician. He was the voice of infectious diseases in Australia. I remember when I wasn't living in Canberra, I'd read the newspapers and I'd see Professor Collignon says this. He was in the newspaper quite frequently. So when I came down here, I had an office next to his in our department, and Peter would go on leave. And then his secretary would get a call from maybe the ABC saying there's an Ebola outbreak in West Africa. Can Professor Collignon comment on it? And our secretary would say, oh, he's not here. But then she'd approach me and just said, Sanjay, Peter's not here. Do you want to do this? And I said, okay, I'll give it a go. And that's how it all started. So I did an interview here. And once you do an interview with a network or a broadcasting service, and you don't do a terrible job, you've done a reasonable job, they'll list you down as an expert. Okay, he was okay, so we'll put Sanjaya Senanayake down if there's an infectious diseases issue that pops up. And same for economics or foreign affairs or whatever, or security or etc. So then, it just built up momentum. Then other networks heard me, and then I would get called and I get put in their books. And so I kept quite busy, but of course it went to another level at the pandemic. So I think in that 2020, 21, 22, I did TV interviews alone. I estimate about 750 TV interviews in that period of time. And if you add all the radio interviews, the podcast interviews, the internet stuff, newspaper interviews, would have been well over 1,000 interviews. So it was a lot of experience. So experience, if you're interested in communication, the more you do, the better. And as I said, I haven't done media training, but if you do work for a big organization, whether it's governmental or non-governmental, certainly the governmental ones tend to have media or communications departments, comms departments, and almost certainly I assume the big private companies would as well. So if you're interested, you should approach them and ask about media training, which people offer. And I've certainly, at the ANU, I've come and spoken to people interested on the health side of things with health communication to try and give some tips. But at the end of the day, it all comes down to experience and just giving interviews.
What's your one takeaway if you can distill it all down from the 750 plus interviews you've done? What's your one takeaway with being kind to yourself? You can prepare all you want to. You can do all of the background work, but sometimes in the moment, the message may not land perfectly as you envision it. Over time, I think you build experience to catch yourself, to reinforce some messaging. What's your overarching about being kind to yourself and the journey of getting there to be able to be a powerful voice? The reason I ask, I see lots of people who are starting out in media journalism and they're professionals in other areas. They compare their beginning to somebody else's middle or end. And they go, oh, I've done a terrible job. I'm never doing that again. I'm like, no, you've got the expertise. You've just got to build this also.
Even someone with my experience, I am very critical of myself, and I was during the pandemic as well, because as I told you, there was a lot on the line. There was a lot of polarization. There was a lot of political involvement with the messaging or the topics that we were discussing. So I was often very critical of myself. So it's good to have a family who can reassure you that you've done a good job and given the messages that you wanted to. But yeah, that is hard. I always, if you have an interview, I always tell people, you broadly know what the topic is. Make sure that you have maybe 2 or 3 points. Stick to those points. Don't veer from them, and make sure you've said them. So if you can do that and come out of the interview, then you've done an okay job. And then maybe you might feel that, oh, maybe I did make that point, but I didn't say it clearly. I stumbled and I shouldn't have done that. You always be a bit critical of yourself. As long as you're not too critical of yourself, that's fine, because you can maybe take that self-criticism to help you with your next interview. So, but you're right, it's important to be kind to yourself and not be too harsh on yourself. Otherwise, you'll be a nervous wreck all the time.
We spoke about this briefly before we started filming, about being a recognizable public figure. How has that weight of expectation or responsibility played with you?
Look, it hasn't been a huge issue. As I said to you before as well, there's different levels of fame. I mean, these days, being on TV isn't such a big deal. You can be an influencer in social media, and you see reports, an influencer has done this or that, and I wouldn't know who they are. So there's different levels of fame. And at the lower level, someone like me, who's a health expert who comes on in the media every now and then, versus, I use the example of Lady Gaga. And my experience of fame is quite different to her experience of fame. And hers is 24/7 in your face and probably very uncomfortable, which is why has bodyguards and things like that. For me, it's a byproduct of what I do. And I don't get, coming here today, walking from the car to this room, I didn't get mobbed by people wanting to take selfies or trying to take off my shirt or anything like that as a memento. But I do have people who look at me on the street and sort of give me a double look where they probably think I do know this. Do I know this guy? I've seen him somewhere before. Or someone does recognize me and says, oh, look, nice to see you. And again, because of the nature of what I do, which is just delivering health information to hopefully help people and populations, the feedback I get is very nice. So I'm very grateful for it. But as I said, this level of fame, and I put fame in inverted commas, doesn't affect my day-to-day life as a doctor.
And I'm thinking back, and you're very humble about that, but you're out at, let's say, lunch with the family, and somebody walks up to you and says, hey, doctor, and this is the first thing I said, I've seen you on a TV screen, but never in person. I didn't realize you were that tall. Have people approached you and spoken to you when you're with your family and different settings?
Yeah, that sometimes happens. Probably the most unusual one was, this is before the pandemic. We'd had, I think, it was some issue which we required our house insurance, involved our house insurance. And then I had to call someone in Sydney, the contractor, who were going to do something like it was a carpet or something like that. I can't remember what it was. And so I dialed the number, and a lady answered at that Sydney office. She said, hello. And then it said, oh, hello, is this so-and-so? I've been asked by my insurance company to give you a call. Then there was a pause, and she said, oh my God, you're on the project. I said, yes, I have been on the project. She goes, I'm really good with voices. I recognize voices, and I've heard your voice on the project. I go, well, yes, I have been on the project. You're that doctor, aren't you? And I go, yes. And this is before that's all I'd done was say, hello, is it this particular place? So that for me was quite extraordinary. I didn't give him my name or anything. So that was one that sticks out in my mind. But yeah, otherwise people just come up to me now and then and say, is this, and occasionally overseas as well, that happens. But otherwise, yeah, it's something I get used to.
You spoke about the project. I loved all of your TV interviews, but I enjoyed a little clip walking around saying, oh, have you heard of Dr. Sanjay's Asparagus Gate? I'm like, what? And then I heard you speaking with your daughter about this. Tell me about, as uncomfortable as that might have been at that time, how does the family who is now part of this whole conversation, who didn't sign up to be part of the conversation, deal with something like that?
Yeah, sure. So the story was, no, I can't remember if it was coriander or asparagus. But
Asparagus, I've listened to it a couple of times.
It is asparagus.
Yes.
Okay, good. So what happened? So when I went onto the project to actually talk about a non-infectious diseases issue, and the issue with asparagus is there's a genetic predisposition where some people perceive it differently to others. And if you've eaten asparagus and it's passed out in or some components of it are excreted in the urine. And so when that happens, the urine can have a pungent or unusual or unique odor if you're genetically predisposed to smell it, but not everyone is. And that was what the story was about. And then I made the point that, oh yes, I got my wife to smell my urine once, and the hosts of the project just sort of jumped on that. And my poor wife got phone number of calls and was approached by a number of friends. Oh my God, I just saw that in the project. She wasn't very happy with me for a long time. And in fact, when I went on the project sometime later and we were talking about something else, and I just said, I mentioned my wife briefly, and one of the hosts said, oh, is that the wife who smells your urine? Yeah, so that was, but generally they're very supportive, the family. But yes, my wife was rather horrified at that, and I got told off a little bit. So
I've also loved your Father's Day conversation with your daughter. That was really insightful of how you look at life as a parent, but also some of the values that you hold close to your heart. What did you learn from that experience of sitting and having a conversation on a live media show with your daughter?
it was wonderful. It was almost coming full circle to, you mentioned that you have very young children, but to see them grow up and start taking on these adult roles is brings so much happiness to someone as a parent. And to see her interviewing me at SBS was it sort of was surreal. It almost blew me away, and she did it so well with such confidence and carried the interview without a hitch. So it was an extraordinary level of professionalism for someone who was so young. So yeah, it made me feel very proud as a parent. And of course, yeah, we got to discuss what it was like being a father and a daughter from her early childhood days to now, and reflect on her values, my values. So it was a great thing. And I told her afterwards, how often does a father and a daughter get to do this, to do a broadcast on some place as prestigious as SBS? So we realized what a unique privilege it had been to do that. And we'll both carry that in our hearts forever.
You have a busy life with your medical practice, with your research work, with your media work. How do you balance the importance that work demands of you and spending time with family and those that mean the most to you?
Yeah, it's a good question. And I think people ask questions, the question that you've asked as well, which often ask is, are you mainly doing research or is it mainly media? But the reality is I'm a full-time doctor who sees patients and treats patients with complicated infections. And I work 7 days a week, basically. I go to hospitals 7 days a week to see patients. So, and I'm not trying to say I'm any busier than anyone else. There are a lot of clinicians, thousands of clinicians throughout Australia and around the world who do that and probably work even longer hours than me. That's certainly my main job, is treating patients with infections. As we heard earlier in the interview, I sort of stumbled onto my role as a media commentator and an expert in infections for the media. But I recognize that has become a big part of the role that I play. And I realize, particularly during COVID, how important it was to a lot of people. So it is something that I'll continue to do. And for example, we again talked about physicians who want to get involved with the media. One thing I should have mentioned was the Australia Science Media Centre. And I've been with them for a long time. They have a list of health professionals who are interested in communicating with the media. And if any big stories break, they will contact us and allow us to, and give us embargoed articles to make comments on, which are then released when the articles are released. So to help that level of education between health experts and the public, and help the public understand breaking stories. So even though it's something I just do, not for money, for love, it's an important part of what I do, and I'll continue to do that as long as I'm wanted to do it. I enjoy teaching as well. So that's a really important part of what I do. And I've written 2 books for medical students and junior doctors, one on dealing with acute medical problems on the wards and in clinics. And that's luckily I got to my 3rd edition with that one. The publisher wants to do a fourth. If I find the time, I'll give it a go. But also a book on infectious diseases and public health. So education has been very important for me, and I want to continue to do that as well. And I lecture at the medical school at the ANU, and we have medical students attached to our unit at the hospital, at Canberra Hospital, and that's an opportunity to give them bedside teaching, discuss cases with them. So that's something valuable as well. And I think you always, in the same way that you feel young through your children, also through the young medical students as well, you maintain that sort of youthfulness and zest for life and learning.
Growing up with the young girls at home when they were that age, being a girl dad, what has that taught you about yourself, empathy, kindness, their needs, the attention they need from you? What has that taught you about yourself?
It's a good question. My girls actually tell me, you're a girl dad. You're much better off having had girls than boys, because they feel that my personality aligns more with that. It's been wonderful. I'm at another level. I'm an only child. And one thing about only children, although they might be nice people intrinsically, by being only children, they're, through environmental circumstances, they're very self-centered because they don't have to share anything with anyone. Their parents give them everything they want, etc. So getting married and having children and seeing how the children have to interact with each other, it teaches you about being less self-centered and more selfless and thinking about other people. So that's been very valuable for me as a family man, just not just as a father, but also a husband, thinking about other people. And as I said, seeing how they interact with each other, how the benefits of having a sibling. I always used to think having a sibling, I'm glad I never had a sibling. I'm very happy as an only child, but I can see how my daughters support each other, and hopefully once I'm dead and gone, they'll continue to be there for each other as long as they're around. So I can see the usefulness of that. Being a girl dad, in this era, it's taught me about the horrors or the negative aspects of social media. And are your kids, are they girls or?
Two girls, yes.
Two girls.
Yes.
So that's a challenge.
Hence, I'm very interested.
Yeah. So it's a challenge you'll have to face. Now, this social media ban in Australia, I think it's actually a really good thing, because not necessarily just my girls, but their friends and their peers going through school, seeing how they had to deal with social media was quite a challenge. Because the thing for us when we went to school, even if you had a bad day at school, you leave school behind. You go home, you're in that sanctuary where no one else can touch you or bother you, and you can calm down, relax, and have that downtime. But with social media, does not allow you that, because you bring your phone home and people are messaging you. And even if they're not messaging you, you're looking at Instagram, where these influencers who have unrealistic bodies and diets and various things are influencing these young minds. So that's been a real challenge. And of course, you look at it the other way, you can say, well, I'm not going to give my child a mobile phone. I'm not going to give them access to Snapchat, to Instagram, etc. But the problem there is, even though you're standing next to your best friend in the school playground, they're communicating to each other through the mobile phone. They're texting each other. They're putting things on Snapchat, etc. So the risk you run by not providing your child with access to that is that they will become isolated. So it's a very difficult situation. But it will be very interesting to see what this social media ban will do, because I do also recognize that Instagram, etc., is very useful. My wife is a very talented designer. She does what's called tablescapes. So she tells a story by laying tables in a certain way and using various themes. Typically she forages for things. She uses things in her surroundings and what we have, and she tries to teach people to do that. And for her, Instagram is very useful because you have very collegiate community of talented artists from all around the world, and you wouldn't be able to access those people's works and their thoughts without Instagram. But at the other end, for teenagers, it can be very damaging. So I think this social media ban is useful. And I'm hoping your kids will have a smoother run than the cohort of school kids that have come through in the last few years have.
Because I think the generation you spoke about had a lot of predictive AI algorithms pointed at them. The difference is there might be generative AI algorithms that kids now have to deal with. But your girls have grown up, you've given them foundations and values, and now they're blossoming to be their own people. What are you most proud of about your two daughters?
Look, particularly my elder one, she had to do school, her last years of school during COVID. And that was a terrible time actually for young people. You have the pressure, the enormous pressure of your year 12 exams and the year 11 work up to those year 12 exams and the ongoing assessments, etc. And on top of that, you have a pandemic. School is disrupted. You can't go to school. Fears of doom and death everywhere. So particularly my elder daughter, I'm so proud that she got through that and graduated and went to uni and did her studies and is now working and doing such a great job in that media sphere. So very proud of her for that. But both of them, I'm most proud because they're good, kind children. Now, we as parents wanted to make sure that our kids were brought up with good values, where they realized how privileged they are to live in a wealthy country like Australia. And I'm Sri Lankan, as you know, so we always made sure when we went to Sri Lanka that we would show them people who are less privileged than us, so they would appreciate what is happening, and they'd do charitable work while there. So they have those values instilled into them that they realize how lucky they are, and they maintain a sense of humility, which they do of their own accord, again, which I'm very proud of, and that they'll continue to be compassionate and serve, whether it's in the media, whether it's in medicine, etc., to provide service to other people. I think those things are very important. I think we live in an age now which is a very materialistic age with gadgets and things and travel and this and that. But at the end of the day, it's making sure that you can provide a role in society where you're kind and you're generous to other people. So we have laid those foundations, but as you know, each child is different. Siblings are different to each other, even though they come from the same parents. So they bring their own personality and they interpret what you teach them, and they make a determination about whether they'll go on one path or another. But the path that they're taking, the values that they have, I'm where my wife and I are very proud of them. We sort of wish them well.
The role of service for a practicing doctor, but also somebody who likes to communicate messages, likes to speak with young medical students. How important is the role of service in your life?
It's very important. So medicine, it's interesting. It's I think, changed in the last few decades. There is definitely a more materialistic component to it. And there are people who want to be doctors to earn money, but the reality is, unless you're a proceduralist in medicine, unless you're doing operations or angiograms, etc., you're not necessarily, you'll certainly have a comfortable living, but you won't be earning money that you might make in other professions like investment banking, etc. And medicine, and on top of that, medicine does take an emotional toll on you. You're treating patients, and if you get it wrong, there's a lot to lose for that patient. So it can be a very stressful situation. And I would say within medicine, you have different personalities when it comes to doctors. And there are some who you get all the personality disorders as well. You see some narcissists, the odd psychopath, and this and that and the other. But I think the vast majority of my colleagues are caring people who feel really bad if a patient has a negative outcome, etc. So doing that for 30 years where you're worried about your patients, where there are some nights where you can't sleep because you're worried about a particular test result or an outcome, that can be a source of enormous stress. So medicine, it's not easy. But it is about, at the end of the day, if you're thinking that you're there to help people, that gets you through it. That you're there to make a difference in people's lives. And yeah, I'll tell my younger daughter as well, who's looking like she'll follow a medical pathway also, that, oh, look, I had a really hard day today. Clinic was tough. There are a lot of challenging things and this and that happened. She goes, yeah, but look, at the end of the day, you finished the clinic, which means you helped every patient that you saw. And she sort of keeps me grounded. And I think, oh, that's true, actually. So that service and knowing that you've helped people so that their health gets better, so they can lead a normal life and contribute to their work life and family life in the way that they want to and live the life that they want to, that really helps me get through the stresses of being a doctor. And I think that will always keep medicine as a noble profession.
Thank you for sharing that perspective. Because I've seen a very celebrated cardiac surgeon who wrote a book called Get Off My Table. And I was very interested as I read through it. It was a fantastic perspective that says that he gets very acute cases and he can save 97, 98% of operations that he does. But he says, you don't know the toll that 2% takes on me. Because the 2% could be a young person who have to walk out the operating theater and tell their young family that I couldn't save mommy. And behind that statistic, there is a human. So that mental toll, that was my first insight to that mental toll that it takes. How do you keep yourself balanced and vibrant considering that mental toll? Do you have your routines where you go for a walk, or do you do some mindfulness stuff, journaling? What helps you?
You've raised a good issue there. You somehow have to try and be objective as possible and not get too emotionally involved. And as I said, within the medical field, literally hundreds or millions of doctors around the world. You've got some people with slight psychopathic, narcissistic tendencies who don't necessarily feel the way this surgeon felt when there are bad outcomes. But at the other extreme, you get people who are completely enveloped by despair. And within the medical profession, there are high suicide rates. It does happen because people can't cope with, and part of that is people can't cope with the stress of what's happening with patients and seeing bad outcomes. And I think if you are like that, you shouldn't practice clinical medicine. There are other avenues in medicine. It's not good for you or your patients to be like that. And it is hard to not feel sad when there's a negative patient outcome, even if it's not your fault. You naturally feel sad, but you have to train yourself to have just that level of detachment so you can carry on. And people do this differently. And yeah, I think just rationalizing it, things like mindfulness meditation, that's something I do, and that does help me as well. But just talking to colleagues, not being isolated, those things are important.
Like you touched on, the medical world or the medical profession is full of a lot of unsung heroes. Who are some of those groups that don't get a lot of attention, that in your mind deserve a lot more attention?
That's a very good question. I often look at how fortunate my life has been not just living in the beautiful country of Australia, the amazing city of Canberra with a lovely family, but having a career where I've been able to help people, but also getting these accolades for my work, my professional work in medicine, but also in the media as well. So I feel very fortunate, but I do remind myself and just think it's ironic that there are other people out there who are doing such great work we never hear about. And the reality is, in our field, there are healthcare workers, so not just doctors, there are nurses, allied health people, so physiotherapists, social workers, occupational therapists, who day in, day out make enormous differences to the lives of other people with illnesses, be they physical illnesses or mental illnesses. And by the end of their career, those professionals would have benefited the lives of thousands. And you will never hear about them in the media. You will never see their name in a newspaper headline. You'll never see them being interviewed on CNN. But they're extraordinary people. And I could talk about healthcare workers who volunteer from a developed country and go and work in a developing country and save so many lives or cure or prevent blindness or do various things. But any healthcare worker in Australia who does their job day in, day out, they are unsung heroes for me. And I'm proud to be part of a profession and work with healthcare workers who do that.
I think it's important to reflect also on how people see their jobs and see their roles. I remember a story of a person that I actually made a point to go and visit in the Maharagama in Sri Lanka, the cancer hospital. Mm-hmm. It was a janitor who was responsible for the visitors section toilet, and their role was to clean that. And somebody asked him, "What is your job? What are you doing here?" And he said, "I've been doing this job for 15 years and I cure cancer." So somebody looked and said, "But what do you mean?" And he goes, "I give people a chance to have a comfortable environment when they are visiting somebody who is actually going through chemotherapy or whatever they're going through. But the pain of that treatment is only managed by the relative or the loved one visiting. And I make a pathway for that." And I sat and thought to go, oh my gosh, if we had that perspective with everything we do in life, we'd be happier. How do you look at the work that you do every day? What's your perspective?
Well, actually, that's a beautiful story. And you're quite right. A hospital wouldn't run wouldn't run well if the rooms weren't clean, if the bathrooms weren't clean, if there wasn't a kitchen providing nutritious food to patients to help them recover. And though everyone working within the hospital contributes to that. And certainly some people have a higher profile and get higher levels of acknowledgement, be that the doctors or the nurses or the allied health people, but every single person. And the maintenance people as well. If the air conditioning doesn't work, if the tap's leaking, all this contributes to a hospital not working well. So if they're all doing their jobs, then a hospital can work well to provide good outcomes, which is to get a patient better without complications and get them home. So that's really important. So I think anyone who contributes to a health service in the community or in a hospital or an aged care facility, you are contributing to this. And you're right. You're an unsung hero. Yeah. But I think the reality is we do see unsung heroes, but you shouldn't think of yourself as an unsung hero. I think if you really just do your job and you see the outcomes, you'll naturally be pleased with how you are. Yeah. And your question again?
How do you see what you do every day? What's the framing for you?
I think it's fairly simple, really. My job is to look after patients with complicated infections, to make their infections better, but also, talking about communication, making them understand what is going on with them, make them feel like they are part of their own solution to getting better, and getting them to a resolution where their infection is cured or under control and they can go back to leading their normal life. So that's my job. And Australia, the healthcare system in Australia, it's geared to patient-centered care, where the patient is central to their health outcomes, that they're part of the decision-making, that they feel they're part of the process, not just an object. And that's different in other parts of the world. It means a lot more talking, a lot more writing, a lot more notes, but I think it's a more satisfying outcome for me as a clinician and obviously for the patients and their families.
What's the percentage or the improvements in outcomes that you have seen when there is a doctor-patient partnership? I've seen lots of people say it's important to have the patient, feel like they're part of the journey towards recovery or a better tomorrow. How important is that?
I think it is important. But I've always worked in that environment, so where we've had this patient-centered care. So I can't directly compare it to a situation where it's not there in terms of personal involvement, but certainly what I've heard from other parts of the world where you have a doctor marching in, where doctors are regarded as, like Sri Lanka, doctors are regarded as deities, superhuman people, and they do wonderful work, of course. But in that situation, the patient listens and they're told what to do. I think the issue there is the treatment may be fine, but if the patient misunderstands or doesn't quite realize what treatment they're meant to take, doesn't understand the side effects of the treatment or the risk factors that led to the disease, if that's not conveyed, and it's very much a one-way relationship, things can go wrong. I suspect that that's potentially the case.
And the reason I ask this is, for 30 years, I grew up in Sri Lanka. My sister works in the healthcare sector in Australia. And if ever we go to the doctor, she'll go, "So what did the doctor give you? What are you taking?" And I go, "I don't know. I've got used to this system that we channel a specialist. We sit in a hospital in Sri Lanka for 3 to 4 hours and you wait for the doctor that you channel because you want to see a specific doctor, and that's your choice. You've sat there now, you're supposed to see the doctor at 6, it's 10:15 at night, you're waiting for that doctor, and then you get a prescription and you get well. But there's no partnership in what are you taking or, why are you taking this? And I've always been very stumped by the question to go, what did the doctor give you? Are people a little more aware of what type of medication they're getting, or they're asking more questions versus going to ChatGPT or Google and trying to type what medicine they're taking.
And look, that the model that we talked about, say, in a developing country where there's a different doctor-patient relationship, that can work if there's a condition that's diagnosed, the patient's given the medication told to take, and they get better without side effects. Or potentially you might have a doctor who says, this is the condition, these are the risk factors for what you have, this is what you must do to not get it, this is the medication, these are the side effects. So if the doctor does that, it might all work out. But if the doctor doesn't give all that information, the patient doesn't know, and they get terrible diarrhea or dizziness from the medication, and they don't realize it's the medication, they continue to take it, and then they collapse, hit their head, and end up back in hospital, then it doesn't work out. So I think it is very important that that information is conveyed. And, we talk about informed consent before an operation. Classically, that you're going to have this operation, this is what's going to happen. I think we should practice that when it comes to tests as well. You're going to have a blood test. I with my patients, I tend to not just say, here's some blood tests, do them. I'll say, these are the blood tests we're doing, and this is why we're doing them. And even prescribing antibiotics, I generally make a point to tell patients, this is the antibiotic we're going to use. And I talk about the side effects, because if patients get nasty side effects on antibiotics, they don't realize it's the antibiotic. They keep taking the antibiotic and it gets worse, etc. And so if this happens, contact your local doctor or contact me. Don't put up with it for too long. So I think it's important for me at least, to communicate what we're doing to a patient, they understand, and give them the opportunity to ask questions to clarify, so they really feel that they've comprehended the treatment plan.
For someone who's got such a busy schedule and lots of things going on, I've also started enjoying your Behind the Curtain podcast. It's illuminating because you cover a range of topics, but you cover why those people are doing those professions. You cover, what are those magical moments somebody has experienced with somebody who's recovering or somebody in their ward. How important is that work?
Well, I think you and I are very much alike, Evan, in the sense that we both like talking to people and hearing their stories. And being in infectious diseases, the field I'm in medicine, I would potentially, could I say this? I think we're arguably the best history takers in the medical field in terms of talking to a patient, because with infectious diseases, you're often trying to chase down a mystery. Why has this person got a fever? Or why have they got this lump? Etc. And to do that, you have to dig deep into their history. You don't just talk about what's happening today. You might want to talk about 50 years ago. Where did they grow up? What country in the world? Where have they been traveling overseas? What recreational activities are they involved in? Did they go whitewater rafting in Ecuador, which could have exposed 20 years ago, which could have exposed them to the certain parasite that might have stayed asleep in their body till now, and it's now woken up. So with our field, we spend a lot of time taking a history, so interviewing patients in depth and asking about their vocation, what they like to do, what they do for work, what they like to do for fun, have they been to farms, etc. So because of that, I would say the average infectious diseases physician is very good at talking, but also good at listening to what people have to say, and also good at getting out bits of information during an interview. So because of that, I think it's helped me transfer to being a podcast host for Behind the Curtain. So it's help me bring out the stories of these really interesting individuals from season 1 of Behind the Podcast. And the reason we did this at Canberra Health Services, we realized that even it's a big organization, and we all live in silos. So someone's just a few offices down from you or a floor below you, and they might be doing the most interesting work in the world, but you just don't realize. So we were able to garner the names of some very interesting people, and there's still a very long list left to go. And we were able to talk to them and ask about how they contributed to the health service. And we learned so much about so many interesting roles. I mean, one of my favorite podcast episodes, I mean, they were all really interesting to me, was our senior mortician, Jess, and what she did in the morgue. Because, of course, as doctors, we worry about our patients when they're alive, but of course, patients pass away in hospital. And then what happens afterwards? And the insight she was able to give into what happens at a technical and even a cultural level for certain religions who have to deal with processing of bodies, etc., was just really interesting.
How important is it in general to have a mentor, but what has the role of having a mentor played in your life?
Mentors are always important. I think throughout life, we've always had people we look up to, and that I think your primary mentors are your parents, someone who's older, more experienced, and from whom you learn. And then as you step into various roles, either consciously or unconsciously, there are people you look up to, whether it's in the professional sphere or a social sphere or whatever. There'll always be someone. So yeah, without thinking of a specific mentor, there are people who have been more experienced than me in medicine, in my field of infectious diseases, I've looked to in terms of inspiration, of becoming a more experienced and better clinician. I mentioned my colleague Peter Collignon. It's through him that I got introduced to the media, and he would always be a sounding board if I needed advice about interviews, etc. He was always there. So yes, it is very important, but it's important to find the right person.
Dr. Sanjay, thank you so much for taking the time to sit down with me, share your insights, share your experience, share your knowledge. I deeply appreciate it, but I don't want it to be ever lost the impact you had on us as we all navigated the challenges of COVID, and we all had different challenges at different times. We had new words like lockdown and vaccine and all of those things. The role you played to share the information, the calmness of which you shared it with, I'm deeply grateful for. Thank you for your time.
Thank you very much for having me on the show, and thank you for that final compliment. As we were discussing earlier, it is reassuring to hear that, because when you do an interview on TV or on the radio, you finish the interview, you hope you've done a good job, but the TV networks or the radio network or the newspaper journalists, they never give you feedback. So you don't really know for sure if you've done a good job. You've just got your own instinct to tell you. So to get this feedback from you and others that I helped in some way makes me feel very humble but very pleased.
Thank you. A huge thank you to the wonderful team at Doma Hotels for sponsoring this episode of the podcast. If you are looking for 5-star accommodation, wonderful event spaces, and carefully curated dining destinations, the Doma Hotels offers all of that for you.